Hi, my name is Passarelli, and I did my essay and presentation on the legalization of recreational marijuana. While medical marijuana has proven to be an effective treatment for management of chronic debilitating conditions in medicine, such as chronic non-cancer pain, treating wasting syndrome and AIDS, muscle spasms, and multiple sclerosis, as well as alleviating trauma from patients diagnosed with PTSD, it is often a question of whether recreational marijuana, if legalized, would also benefit more than it would risk the population in which it was used. A study done by the National Source of Drug Use and Health in the year of 2020 reported that among people 12 and older, 17.9% of the population, which is around 49.6 million people, reported using cannabis in the past 12 months despite it being illegal under federal law. Marijuana does present a risk to the body systems, such as affecting a person's neurological and while medical marijuana has proven to be an effective treatment for management of chronic debilitating conditions in medicine, such as chronic non-cancer pain, treating wasting syndrome and AIDS, muscle spasms, and multiple sclerosis, as well as alleviating trauma from patients diagnosed with PTSD, it is often a question of whether recreational marijuana, if legalized, would also benefit more than it would risk the population in which The debate over legalizing marijuana centers squarely on the definition of a Schedule I drug and whether cannabis should still be considered as such. According to the Controlled Substance Act passed by Congress in 1970, a Schedule I drug has a high potential for abuse and was not accepted for medical use or recreational use because of the safety concerns surrounding the substance. Although it was labeled as a Schedule I drug, it has since been legalized recreationally in 18 out of the 50 states and legalized medically in 37 states. Research suggests that cannabis use is associated with potential therapeutic benefits, but also has individual health harms. The evidence, however, is inconsistent and in some cases inconclusive regarding how recreational cannabis legalization affects outcomes significant to public health, including cannabis use disorder, cannabis-related hospitalizations and poisonings, as well as driving safety, compared to other substances. If legalized, researchers can improve on existing evidence by targeting the understudied areas of cannabis, which may include marijuana markets, policies, or characteristics of cannabis, such as their price, potency, and product type. In the face of uncertainty regarding health consequences of legalization of recreational marijuana use, policymakers should continue in their research and evaluate how policy and regulation support the legalization of recreational use. My thesis is, although the legalization of recreational marijuana use may cause physiological risks, authorizing the use has the potential to produce significant state revenue, decrease crime rates, improve safety, and ensure an individual's fundamental right to autonomy and justice. The ethical principles that I analyzed most within my paper were autonomy and justice. Focusing on autonomy first, autonomy is defined as acknowledging the moral right of every competent individual to choose and follow his or her own plan of life and actions. According to the CDC, alcohol has been the cause of more than 95,000 deaths in the United States each year, or rather 261 deaths per day. Drinking excessive amounts of alcohol can lead to disorders or diseases such as cancer, diabetes, cardiovascular disease, as well as liver and pancreatic disease. And yet, it is still legal to drink alcohol, and it is advertised in the United States as something enticing. There has yet to be a report of a marijuana-related death in the U.S. Marijuana, however, does come with its negative effects, but if it's mandated and regulated, an individual should be able to exercise their autonomous right to use marijuana just as they have the right to drink a glass of wine. In analyzing justice, justice is referred to the moral and social theory that attempt to distribute the benefit and burden of a social system in a fair and equitable way among all participants. Much of the unfavorable view of marijuana stems from the Great Depression, when many people from Mexico who immigrated to the United States were smoking marijuana recreationally. While going to find work and spreading to nearby cities and towns, their practice of smoking marijuana spread as well. Around that time, it was a time of extreme prejudice, already well developed against Mexicans, soon attached to these immigrants' drug of choice. The transition caused citizens to have a warped ideology surrounding the substance and associated cannabis's use with crime. In 1937, marijuana was to be prohibited to be consumed. Due to the misunderstanding surrounding marijuana and systematic racism, people of color are more than likely than any other citizen to be searched and accused for the use of cannabis. These racial disparities in marijuana arrests account for a complete lack of justice in how officials are enforcing the laws. Almost 1/3 of drug arrests are from marijuana use, and Black people are 4 times more likely than white people to be arrested for marijuana, despite similar usage rates. Having a criminal record, especially for something that is drug-related, makes access to housing and jobs increasingly difficult. Legalizing marijuana may not completely resolve these racial injustices, but this can aid in taking the fear away that people of color may feel when they use marijuana. Those opposed to the use of marijuana may also say that justice is conflicted in this situation because it's unethical to allow those to use illegal drugs. However, if legalized, they would not have this issue. The one ethical principle in conflict is non-maleficence. Allowing people to use marijuana recreationally could pose health effects to them depending on the potency of marijuana and how much they smoked or ingest, making it a risk for individuals. Finding ethical codes that relate to the use of recreational marijuana use was a bit difficult because we are not talking about it in medical terms. Therefore, the only ethical principle that I found that relates to the concept of giving individuals the autonomous right to use cannabis is within the ACHE Code of Ethics. It states that a healthcare professional must work to provide a process that ensures the autonomy and self-determination of patients or others who are served. Many people opposed believe that the best outcome of these individuals seeking to use marijuana recreationally need to have a significant medical reason for their use, or rather stray away from the federally illegal drug altogether. However, in respecting autonomy for these individuals, legalization is crucial. In proposing a resolution to the controversy, it is necessary to look at states that have already legalized cannabis use recreationally in order to propose safe and purposeful consumption and administration. In states such as Colorado, which was the first state to legalize non-medical marijuana use, the Colorado Marijuana Enforcement Division proposed that anyone younger than 21 years is not allowed in dispensaries or in retail stores. Setting age restrictions in order to buy marijuana promotes safety and disables the ability for younger populations to buy marijuana legally. Although this may not give every age group autonomy to access marijuana, this allows restrictions for safe usage by allowing those 21 and older to use cannabis. This rule also enables similar age restrictions comparable to alcohol purchases. Most of the backlash surrounding marijuana is for its adverse effects. The risks associated with ingesting marijuana depend on the potency of the THC within cannabis. To manage some of these effects, a law can be instilled that prevents dispensaries from achieving a potency percentage above a certain amount. If the percentage of THC is above a certain therapeutic range, marijuana is usually used to produce a high, and the increased potency makes them potentially more dangerous and more likely to result in addiction. By placing a restriction on a level of THC, this can help prevent the harsh effects that can come with high potency levels. This ensures a safe dose range. In Vermont, their statutory cap on THC within marijuana products is 30%. Although this is higher than what is recommended as an adequate dosing percentage, which is 10%, this is a start in order to regulate the effects of marijuana. Just like the age requirement, this gives an individual the autonomous right to smoke and ingest cannabis, but mandate its use. An individual's right to autonomy and justice takes precedent over the existing view of recreational marijuana use in today's society. Having an autonomous decision to smoke recreationally will allow individuals to have the same right as they do with alcohol or other legal substances that may compare. Legalization of cannabis will allow those incriminated on cannabis drug-related charges to be freed. This in turn will create more jobs for the marijuana industry and boost the economy by creating more revenue on its behalf. By educating the public on marijuana safety and setting mandates on its use, we as a society will be able to end the debate on its beneficiality. It is possible for the benefits to outweigh the risks. An